Welcome to Transition University. This is our Transitioning to Adult Healthcare module. Once a child turns 18, they are considered an adult, and healthcare providers are not required to communicate with parents. In addition, you may not be allowed access to your young adult's medical records. Based on your young adult's needs, you may want to consider limited guardianship for healthcare, a medical power of attorney, or an advanced healthcare directive. Pediatric providers can help with transitioning to adult care. Start this conversation well before the 18th birthday and formulate a plan so there are less surprises later. Some conditions are treated past the 18th birthday with pediatric providers, so make sure you know if you fall into that category. Here are some things to think about. Which doctor am I most comfortable meeting with? Does my doctor listen to me and respond to my input? Is there one doctor who can meet most of my needs? There isn't a right and wrong way to switch providers. It is about your current needs and where they can be best met. Your relationship with your doctors and finding those that really understand you is critical to the process. Family doctors see patients of all ages and can be a great resource. When you transition is based on individual need. It doesn't need to be at 18. Transition is about the relationship between your child and their medical needs. Find a doctor that really understands you, your child, and what works well with you. Hipaa authorization is consent obtained from a patient or a health plan member that permits the sharing of medical information. Medical power of attorney can also include a Hipaa release to access the principal or the youth's private healthcare information and communicate with the principal's healthcare providers, unless the power of attorney specifically restricts that authority. If outlined, the power of attorney can also be used to make medical decisions for the principal if they are unable to do so. Utah's Advanced Healthcare Directive outlines circumstances where another person can make medical decisions for an individual and includes written instructions on the individual's desires, should they be unable to make decisions. If outlined, the directive can also include a Hipaa release, gives permission for the agent to talk to the medical professionals, and make decisions about the principal's care. A living will can also be included in the directive. A living will is a legal document that lays out preferences regarding healthcare, such as refusal or acceptance of medical treatment, in addition to the optional selection of a chosen agent or decision maker. A living will is also included with an advanced healthcare directive, or it can be a separate document. See the red section of this booklet for additional information on wills and trusts in the Choices booklet on the Utah Parent Center website. Utah Declaration for Mental Health Treatments is a declaration that allows or disallows mental health treatment. It also gives the young adult the opportunity to appoint a person as their attorney in fact, the person named in the power of attorney to act on their behalf, to make mental health treatment decisions for them if they become incapacitated. There are QR codes and links for this resource in the Choices booklet. Young adults should interact directly with their providers, ask questions, and make decisions with a level of support based on their needs when changing from pediatric to an adult model of healthcare. Examples of topics to discuss are as follows: know your diagnosis, knowledge of drug allergies and your dosage, know how to access your medical records, understand your durable equipment, carry your ID and insurance card, write down questions ahead of time, decide who sees your medical records. In addition, young adults need to know where to access information. Where's your family contact information, your emergency information, your emergency care plans, general medical information, immunization information, insurance information, and other considerations. Consider helping youth make a document or a healthcare notebook that contains this information. This notebook can contain pages that could help you to keep track of information about your young adult's health or their care. Examples: a page to track medical events like an event diary, medicine changes, phone numbers for providers or specialists, health history including surgeries, procedures, lab work, allergies, etc. Document any needed support services, medical services, or equipment. You can also set up an ICE, which is in case of emergency, in your phone. Also think about technological advancements with your phone and other technology. For example, an Apple Watch can hold your health information, and some emergency workers have started looking for Apple Watches. In addition, an Apple Watch can identify when someone falls and call an identified person if a fall occurs. You can record patient information like medications, Intermountain Healthcare patient sites on their sites. Information stored and is able to be seen with any Intermountain facility. Doctors can pull up this information. Other providers store information in UHealth, MyHealth, and other platforms. When you call to make an appointment, you will need your name, address, insurance information, and your date of birth. Consider having those in a note you can easily reference before and during the call. You do not have to call alone. Ask a trusted family member, support staff, or friend to help you. Just make sure you are doing as much of the talking as possible, and your helper is just there to support you as needed. Medications need to be managed carefully and thoughtfully. Know how and when to take them as prescribed by the doctor. Never share them with others. Be aware of the possible side effects and don't take medications from people not authorized to give them to you. Also be aware that consuming alcohol, when of legal age to do so, can affect some medications. Supported decision-making can be a tool to help loved ones through medical transition process. We have an example of supported decision-making in a healthcare scenario in the blue section of our Choices booklet. The red section of the Choices booklet also describes supported decision-making in detail. Another aspect of care is self-care. We need to remember to schedule dental and eye checkups. A handy and helpful tool may be to schedule all yearly appointments in your birth month. That way, each year as your birthday approaches, you know you need to make your yearly medical appointments as well. Understanding insurance can be complicated. Let's go through a couple of different vocabulary words. Premium is the monthly, semi-annual, or annual amount that must be paid for your health insurance plan. Your copay is a predetermined amount that may be required to pay as you share your cost of the medical service. Your deductible is the amount you will pay for covered health care services before your health insurance or plan begins to pay the agreed percentage. Your out-of-pocket max is the maximum amount you can pay in a year. A health savings account are the best way to set aside a portion of your money pre-tax to use for medical expenses. Some allow you to roll over to the next year, and some you lose the funds if you don't use them. You would want to estimate carefully how much you would use and add that amount to the account. This can be used for copays and medical expenses as defined by your HSA or medical plan. Medicaid provides healthcare coverage to millions of Americans, including those with disabilities. Medicaid is administered by individual states according to federal requirements. To be eligible for Medicaid, your young adult must meet a program type and meet the rules for Utah residency, income, and citizenship. If you are unsure if your child qualifies for Medicaid, you should apply for them. They might be eligible depending upon your household income, family size, age, disability, and other factors. In the blue section of our Choices booklet, we have QR codes and URLs that will help you connect with Medicaid. There's also a process to apply for SSI first. The SSI application process streamlines the Medicaid application process in Utah. You may apply for Medicaid for your young adult in person, by mail, or online. When the application is received, the Department of Workforce Services, or DWS, will contact you by mail or phone. The Department of Workforce Services, DWS, may need more information to determine if your child is eligible for a medical program. DWS will also notify you of what proof you will need to require, for instance, a birth certificate. A Medicaid waiver is a type of Medicaid program designed to serve people with varying disabilities. In Utah, the Medicaid waivers are administered by the Utah Department of Health and Human Services. Each waiver is slightly different in terms of the services that they offer, and they are designed to serve a specific population of people. Waivers can vary based on the level of care, the type of disability, your age, and the level of skilled nursing required by the individual. In addition, if your young adult has been denied SSI or Medicaid in the past, it is still worthwhile to apply for a waiver. Waivers don't necessarily look at SSI or Medicaid qualification guidelines. Apply for DSPD, which is the Division of Services for People with Disabilities. Yes, there is a waiting list. Individuals come off the waiting list based on available funding and the needs of the individual. However, it's worth applying and getting on the waiting list because you may qualify for a one-time pool of funding while you're waiting on the waiting list. If you have questions about transitioning to adult health care from a pediatric provider, please reach out to the Utah Parent Center and ask to speak with our Utah Family Voices project, and we would be happy to help you.